Welcome, folks. Thanks for being here with us today. As folks are coming in, if you will go ahead and introduce yourself in the chat. Happy almost spring break. Sure. Great to see so many folks here with us today. Thank you all for joining us on a beautiful day as we get ready for a break that I think we all need and deserve. I apologize for our background noise. Seems some folks are getting started on basketball behind me, so. All right, looks like we still have most folks getting here. We'll go ahead and get started. So we've got time for this great conversation today. My name is Amy Harrigan. Welcome to our March meeting of the Carolina Community Coalition. And today we're talking about the intersection of cannabis, mental health, and suicidality. So really excited for Margo to share some of the things that she's learned today. A couple of housekeeping things as we get started. Please use the chat to introduce yourself, to have conversations, to cheer on our speaker and panelists as we go. We do have the ability to use the Q&A function to ask questions of our panelists or our speaker. And so we would encourage you to use that function so that we don't miss your question in the chat. We are recording all of our sessions, all of our coalition meetings. So they are now on our YouTube page for Sape, and I will upload this one next week so that anyone who would like to use the videos of these to for any purpose in the future, you are welcome. With that, I think that might be all the housekeeping things, maybe. So I will go ahead and introduce our speaker today. Margo Leitschuh is the communications coordinator with Missouri Partners in Prevention since 2017. She holds a bachelor's of health science from the University of Missouri Columbia. In Partners in Prevention, she works primarily on projects related to best practices in substance misuse prevention, impaired driving prevention, and suicide prevention. Margo is certified substance abuse prevention skills training facilitator, Green Dot trainer, and a NASPA certified peer educator trainer. And we are so excited to have Margo with us today to talk about this important topic. So take it away, Margo.
Great, thanks so much, Amy. So I am Margo Leitschuh, the communications coordinator with Partners in Prevention. We are a coalition of 24 colleges and universities in the state of Missouri. I'll tell you a little bit more about our organization, but information is there. I can post that in the chat later. Feel free to reach out to me if you have any questions. But really the outcomes for this session, we'll talk a little bit about the link between cannabis, mental health concerns, and suicidality. There's a lot there, so I won't go too deep into it. I'm sorry, I'm getting an unstable internet notification, so I'm going to go off video. We will also delve a little bit into the co-occurrence of cannabis use, mental health concerns, and suicidality among Missouri college students specifically, and then we'll also look at some subpopulation data with some survey data that we collect. And then I'll try to talk through briefly just some potential prevention and intervention strategies as well. So first, I mentioned this, but we're a grant-funded organization of 24 colleges and universities with the mission to create healthy and safe college campuses, really working to address the critical health behaviors of college students, primarily alcohol their drug use, but also mental health concerns and suicidality, interpersonal violence, etc. So the goals of our coalition, we provide a lot of training and technical assistance to campuses. We work to connect them all with each other. And we really encourage a data-driven approach, and we facilitate a lot of evaluations so that campuses can understand what the problems are, what their students are experiencing, and then implement strategic plans for prevention to better serve their students. So I'm going to talk about some of the data that we collect in a minute, but this work really informs directly what a lot of our campuses do, and they use the data regularly. So a little bit of background of sort of why our coalition started to look at this intersection with our data. Right, there's a lot of research that indicates that there's comorbidity between mental health concerns and cannabis use and other types of substance use. We know that's correlational, not necessarily causal, but we do see that overall, right, there's that strong body of literature that shows those associations, certain mood disorders, anxiety disorders, et cetera. We see that these folks may be using cannabis at higher rates, and they might experience worsened health outcomes, mental health outcomes, excuse me. And again, we know that all of these are linked. So last summer, there was a study that was published that showed survey data from over 280,000 young adults and found that cannabis use was associated with increased risk of thoughts of suicide, suicide plans, and suicide attempts. And what we're seeing right now is really a convergence of these four factors. So there's a changing landscape of cannabis and cannabis use in our country. We know that more states are moving to legalize cannabis either for medical use or for adult use, recreational use. And so we're seeing that the conversations are changing, and that more students might have different perceptions than in the past about cannabis, about its potential harms or lack thereof, right? So we're seeing this sort of national change around that. We're also seeing rising rates, particularly youth and among colleges. So the Monitoring the Future study, which is a nationwide, I think is indicating like a 40-year, 44% of college students saying that they have used in the past year, and are missed maybe 5 or 6 years. And also we are seeing rising suicidality rates, particularly among youth, really that 18 to 24-year-old age group. I think it's currently sitting in the nation and in most states, potentially anywhere from the second or third leading cause of death. And then along with that too, we're seeing that the cannabis that folks are using is very high potency. So I know there have been some studies based on cannabis seized by the DEA that shows that the THC levels have been rising over the last 30 or 40 years. And a lot of the THC the cannabis that can be purchased legally has high potency THC. Anything above about a 10% THC content is labeled as high potency. So as we're seeing all of these things, right, we know that students might be using cannabis more frequently. It may be impacting their mental health. And so if you've ever heard Dr. Jason Kilmer at the University of Washington speak, he does a lot of research on this topic, and he talks about how we cannot address college student mental health without addressing cannabis use. And though folks may want to talk more about mental health concerns, we cannot have that conversation without talking about specifically cannabis use and substance use concerns. So like I said, we'll share some data from a statewide survey that we do. We call it the Missouri Assessment of College Health Behaviors, MACB survey. We've been implementing this survey since 2007. It was adapted originally from the core survey. We do it online. We implement it for about 2 weeks on every campus that we work with in the spring. And then we usually have results and data for our campuses by early summer. We do a random sample of the campus populations. If the campus is small enough, we may sample the whole population. And we work to map the sample onto the general demographic makeup of the campus so that we get a good representative sample. So I'm going to share some 2021 data. We're in the process of implementing our 2022 survey right now. But we had over 10,000 respondents in 2021, which is about an 18% response rate. It is a large survey. We have a little over 200 questions total, although not all students will see all questions, but we asked some demographic questions, some questions about policy awareness and enforcement or perception of enforcement of those policies, sort of a battery of substance use, so alcohol, cannabis, tobacco, and nicotine, and other drug use, both prescription drug misuse and illegal drug use. Questions related to interpersonal violence, particularly experiences of abusive relationships, non-consensual sexual contact, and stalking. And then some questions related to mental health concerns, suicidality, and just general well-being questions. We do cycle in and out some questions. Campuses have the option to add extra questions to the survey to make it slightly customizable. So I'm going to share just a couple of data slides with you all. But first, looking at, in Missouri, among our Missouri college students, what past year cannabis use looks like. So in 2021, we have 28% of Missouri college students who say they have used any type of cannabis at least one time in the past year. The most common form that students report using is smoked cannabis, so something like in a pipe, a blunt, a bong, but that is followed pretty closely by edible use. So edibles meaning any type of cannabis or THC in a drinkable or edible product, and we have seen that increase since we started asking that question in 2018. We also added vaporized cannabis to our survey last year, so something like an e-cigarette or mod device. And we've seen that go up just slightly at 16% of students. And then just over 9% of students say that they've used some type of derivative form. So that could be wax, dabs, oils, typically more concentrated forms of cannabis. So we did see kind of a big jump from 2016 to 2017, and then things have remained relatively steady. Our statewide data is a little bit lower, like I said, than the national, some of the national data that depending on where students, maybe 44% of students say that they've used cannabis in the past year, but we're hovering right around anywhere from maybe a quarter to a third of Missouri college students. And so then we also do want to break down the past year cannabis use frequency. And when we look at some data later, we'll do some crosstabs of use frequency with mental health concerns and suicidality. So we've really broken this up into 3 different groups. So students who do not use cannabis, so 70% of Missouri college students have not used cannabis in the past year. 14% say they've used 1 to 6 times per year, and just over 4% say they've used 1 to 2 times per month. So we've grouped these into really students who are infrequently using cannabis. But students using cannabis more frequently, so 2.8% say 1 to 2 times per week, 2.9% 3 or more times per week, and just over 4% say they're using daily. So this is about 9.9%, almost 10% of Missouri college students. And so we'll refer to that percentage as students who frequently use cannabis, and then 2% of students preferred not to respond. We also asked some questions about the motivations for using cannabis, and I think this is important as we think about potential prevention strategies. Most of the highly indicated ones, relaxing, having fun with friends, getting high in and of itself, but a pretty high percentage of students also indicate things like to help them with anxiety, to help them sleep, or to relieve pain. Certainly, this question is check all that apply, so it could be multiple factors for students, but we do want to know maybe what's contributing to their decision to use cannabis, and that can help us when we're wanting to have conversations with students if they're trying to quit or cut back. So moving on to the past year experiences of mental health concerns. So we asked students which of the following they've experienced. It's not necessarily a formal diagnosis, but students would still indicate that they've experienced some type of mental health concern. So students who have experienced at least one mental health concern, we're sitting at just under 3/4 of Missouri college students say they've had some type of mental health concern in the past year. The most common being anxiety, followed by major depression, panic attacks. About 1 in 4 students say they're experiencing chronic sleep issues. And then just over 6% self-injury behaviors, typically non-suicidal self-injury. But you can see that since 2015, all of these have gone up in some way. And so at least our data is supporting that, a higher percentage of students, maybe there's a comfort with disclosing that they're experiencing mental health concerns. Certainly it's not of them are suddenly starting to experience more mental health concerns, although that could be a factor, but we have seen all of these increase. And then finally, looking at some suicidality data. So we ask about suicidal thoughts in the lifetime in the past year, and then if students have had a suicide attempt in the past year. So almost half of Missouri college students, 46%, say that ever in their lifetime they have had suicidal thoughts. And then the percent in the past year has really increased, and we're sitting at 1 in 4 students saying they've had suicidal thoughts in the past year. The percent of students who say they've attempted suicide in the past year hovers around 1 to 2%. Although we know that there are students, of course, who are not captured in the sample. It's possible that they've left school due to their mental health or suicide concerns. I don't have data on the number of suicide deaths on our college campuses, but anecdotally, we do know that campuses lose students to suicide every year. And so there certainly is a piece of this puzzle missing in the percent of students that wouldn't be able to take our survey. So this is really where that cross-tab data comes in. So we're looking at the frequency of cannabis use crossed with the experiences of mental health concerns. So like I mentioned, we are breaking this into no cannabis use, which are the light green bars on the left side. Students who infrequently use cannabis, so that was 1 to 6 times per year or 1 to 2 times per month in that middle green bar. And then students who frequently use cannabis, so 1 or more times per week in the bars on the right-hand side. So what we see is that positive correlation between the frequency of cannabis use and some of these key mental health concerns. So among students who frequently use cannabis, 83% of them say that they have experienced anxiety in the past year, compared to only 59% of students who don't use cannabis. And this trend holds true for major depression, chronic sleep issues, and panic attacks. And then if we sort of flip it, 30% of students who have not used cannabis in the past year say that they have not experienced a mental health concern, but that number drops to only about 9% of students who frequently use cannabis. And then if we look at our frequency of cannabis use and suicidality data as well, this trend is very similar. So only 19% of students who don't use cannabis had suicidal thoughts in the past year, compared to 43% of students who frequently use cannabis. And then the rates for past year suicide attempt are certainly higher among students who frequently use cannabis, although again, there's that correlation, and even students who are infrequently using cannabis were more likely to report both mental health concerns and suicidal thoughts and attempts. So I know that was a lot of data very quickly, but just to summarize, really our data supports sort of that national survey as well, that we see a correlation between the frequency of cannabis use and experiences of mental health concerns and suicidality. And like I mentioned at the beginning, while we know that cannabis use is not necessarily causing these mental health concerns, it's not causing suicidal thoughts, there are certain symptoms that can potentially worsen. And we see that a lot of the withdrawal symptoms of cannabis also mimic maybe some of the reasons that students started using cannabis in the first place. And so when students are wanting to quit or cut back, but they experience some of these things, it can make it difficult or undesirable for them to quit. And if they're self-medicating with cannabis, then they think, aha, it was working, right? My symptoms came back. But it is possible that those could be withdrawal symptoms. So we are also going to delve a little bit into some subpopulation data and thinking about which students may be at highest risk for both suicidal thoughts in the past year and frequent cannabis use. So historically, or just in general, there are certain subgroups who are at higher risk for experiencing suicidality. Those typically map onto historically marginalized and oppressed groups. But we see, across the board, and suicide can certainly impact anyone regardless of any identity group. But these were the subpopulations where we saw more significant differences in past year suicidal thoughts. So again, 1 in 4 students, 25% experiencing suicidal thoughts in the past year. But we see that much higher among our students who identified as lesbian, gay, bisexual, queer, questioning, asexual, or pansexual, so sexual minority students. We do separate that from students who identify as transgender, genderqueer, gender non-binary, while potentially related, gender identity and sexual orientation aren't necessarily the same, and so we do separate that out. But about 62% of our TGQN students say they have had suicidal thoughts in the past year. It's also higher among our students with disabilities, and slightly higher among our students who are veterans on campus. And then an interesting pattern that we have noticed, and that when we've delved into our data, we also see this higher among students who have experienced an abusive relationship in the past year or non-consensual sexual contact. So there absolutely is a correlation, or we see them linked, that experiences of trauma and interpersonal violence are potentially contributing or linked with suicidal thoughts. We did not see a real difference when we broke this down by racial and ethnic groups. So even though that is certainly an important piece of this puzzle, our data didn't necessarily reflect that. And I also want to say too that we know that these identities are intersectional, and that students could belong to multiple groups in these categories. And so while we do separate them out, we do know that there could be students represented multiple times on this slide. And then we look at the percentage of students who frequently use cannabis in these subpopulations. All of these map really similarly as that last slide. So 9.9% of students say that they have frequently used cannabis, and that is 18% among our LGBTQAP students, 19% of TGQN students, 16% for students with disabilities, a little bit higher for student veterans, and then 18 and 19% for students who'd experienced an abusive relationship or non-consensual sexual contact. I didn't include sort of the counterparts, students who hadn't experienced an abusive relationship or non-consensual sexual contact, et cetera. But for almost all of these groups, the rates are double what they were of their counterparts, or at least significantly higher when we did some analysis. But like I mentioned, we do see, right, that these same students are both experiencing past year suicidal thoughts and may be more likely to frequently use cannabis. So a little bit into the implications for prevention work. We have talked a lot about screening with our campuses, screening in multiple settings. So in mental health appointments, are students being screened about substance use? And vice versa, when students are maybe meeting with practitioners related to cannabis use, if you do something like K6 or iChamp, are there conversations about mental health? Are students screened potentially with a suicide rating scale, or the patient health questionnaire 9 or something like that? We know that screening, brief intervention, and referral to treatment is a really good evidence-informed strategy. And so if that's something that makes sense for your campus, screening is a great option. But also, I think there's such a need for cross-training, right, of all of these different topics, that we need to make sure that our substance use prevention professionals are trauma-informed, because they may be more likely, if they're, seeing students who are frequently using cannabis, it's possible that they have experienced trauma, or again, that they may be at higher risk for suicide. And so do practitioners know what to look out for? Do they know how to refer to services, et cetera? And then vice versa, again, too, right, that our folks in mental health treatment or violence prevention may be more likely to interact with students who are using substances, potentially to cope or to self-medicate. Right, and so also the need for partnerships, partnering in various divisions. So if you work in substance use prevention and you aren't regularly working with these folks, that's such an important piece of this puzzle to, just partner across sectors. I'll talk a little bit on the next slide about the focus on harm reduction and the need for talking with students about how they can lower their risk with cannabis use. I know that is potentially political. I know it depends where you are in the country and maybe your ability to talk about students using cannabis. But I think that is really where we need to be moving and need to be talking with students about how they can reduce their harm when using cannabis. And then finally, both establishing and promoting cessation services. I didn't show data on this, but our data also indicates that students who use tobacco and nicotine products are much more likely to also use cannabis products. So if you have any type of cessation services, just again, kind of making that link that if folks are talking with students about quitting tobacco and nicotine, there may be a need to also talk about quitting cannabis. And I'll share one more data slide about intentions to change cannabis use. And I think often we might have a perception that students don't want to quit, that they're using and they like it. It's maybe there's a cultural aspect to it and maybe part of their friend groups and things like that. But we do actually see that students are potentially wanting to change their behavior. So these are just quickly the lower risk cannabis use guidelines that have come out of Canada's National Health Service, right? So just hitting home with students that the only way to completely avoid risk is to not use, but all of these other low risk strategies or lower risk strategies can be really powerful and important. So limiting use, using lower THC content, etc. All right, so one last data slide, like I said, so we ask a question about, intentions to change. Are you thinking about, or do you feel you need to change the way you use cannabis? And among our students who use infrequently, so 1 to 2 times per month or less, most of them, 71%, say they don't need to change, which makes some sense, right? If they're using infrequently, that's totally okay. And 4.7% say that they're thinking about it. About 2% say they're ready. And almost a fifth are currently trying. So maybe they indicated that they use less frequently, and that's because they've already initiated their behavior change. And then 3.5% of students prefer not to respond. But when we look at students who use frequently, again, so 1 or more times per week, just over half say that they don't have a need to change, but we're seeing much higher percentages in the percent of students thinking about using less or quitting. So they're in that contemplation phase. 4.2% say they are ready. And then again, almost a quarter are currently trying to use less or quit. So we might have students who are using, 1 time per week, and that is what they have cut back to. They maybe were daily users, and now they have moved along a little bit. So again, I do think there just is a need to talk with students about the fact that they may want to quit or change, increasing assistance and programs where we talk with students about changing how they use. So just some quick next steps. So if you all have local data, if you have any way to look at the needs of your students specifically at specific subpopulations, that's such an important piece of this. Missouri students are not going to be the same as students in South Carolina. Creating and strengthening, again, those partnerships related to both alcohol and other drug use prevention and mental health and suicide prevention services. Screening tools and programs, if that makes sense for your campus. I know I talked a little bit more about the cannabis use prevention aspect than the suicide prevention aspect, but if you could have some type of suicide prevention recognition and referral skills training on campus, something like QPR or something else that you all have homegrown, that's a great option. I also think too, just reviewing any procedures or policies that you have related to sanctions and training. So are those folks, like I said, cross-trained on different issues? Are any of your sanctions or policy violations, are they very punitive? Is there a psycho-ed component? Things like that. And then I already mentioned just providing or strengthening cessation resources, both for tobacco and nicotine and cannabis use. I feel like I went through that very quickly. But I will pause, see if there are any questions, but then I know we're moving on to the panel portion. So I will turn things back over to you, Amy.
Thank you so much, Margo. So much information packed into such little time. So I appreciate all the information that you were able to compile there. I want to encourage folks to put questions for Margo or our panelists in the Q&A so that we can make sure we get to them. As we are talking in the next few minutes, I'm going to put some resources in the chat for resources that we have for cannabis, and we can share some of the things that we also have on campus for mental health concerns as well. But I would like to invite our panelists to step to the stage, right? To turn on their cameras, and we'll do some introductions. And I will, there we go. I will call you out so that we don't have to trip over each other. And maybe if y'all could share who you are, where you're from, what you do on campus, and then we'll ask some questions and have some conversation about this. And LaQuana, I'm going to start with you and ask you to also share just a little bit about the resources that we have on campus for mental health. Since I'm going to share some of that in the chat for cannabis as well.
Absolutely, Amy. Thank you for having me. Hi, everyone. My name is Laquana Shepherd. I am one of the program coordinators here for mental health initiatives with a focus in mindfulness and resilience programming. We are really focusing on wellness coaching right now. We have wellness coaches available for various different resources for students, whether it's nutrition or you're looking to increase movement in your day, or you're just looking to find out more about nutrition, time management, resilience, all of these things that our wellness coaches are working with students on. You can book an appointment through My Health Space. For the students, they can do that. We're also pushing the TAO app, which is available for Android and Apple users, and it's really self-directed therapy assisted app where if you're struggling with anxiety, depression, loneliness, and you want to go on this app and learn more about how to support yourself and what resources are available to you. Also, there are ways that you can access that and also get responses from therapists and counselors on campus. You can use the TAO app. There's also group counseling, which is the third thing that is really being advocated and pushed for students to access. You're probably more likely to get into group counseling right now with this increase, that's why we're all here, understanding the crisis that is happening for mental health and how there is a really high need right now for individual counseling. So you're more likely to be able to access group counseling and get in when you need it. And sometimes it's nice to just be in the room with other students who are also trying to figure out how to tame worry and also trying to figure out how to deal with all that is going on. So it's nice to have the group counseling option right now. And I know CAPS is also having some early walk-in appointments. And if you go on their counseling and psychiatry page on the website, you can find out more about kind of what they're working on for the early walk-in appointments. It's a little bit about what we have on campus as well, which you can still put in presentation requests and access what we have through mental health initiatives as well. So thanks for having me.
Thank you, Laquana. And Dana, you are next on my screen.
Hello, thanks for having me. So I'm Dana Cullum. I'm dealing with a sinus infection, so please excuse my hoarseness a little. I'm the director here at USC Aiken of the Counseling Center and the Office of Disability Services. I'm also a licensed professional counselor, so I do get to provide counseling services here. My background is mental health as well, and we did do like co-occurring disorders and stuff where my background is from. So absolutely, there's been a huge overlap in substance use treatment and mental health. It's definitely a comorbidity there. Here at USC Aiken, we provide counseling services to our students, just really based off of whatever they may need. We do have a drug and alcohol coordinator. That was my previous position. I was a counselor and alcohol and drug educator. So I would provide just counseling services in general, mental health related. And along with that, when we had judicial cases that were related to alcohol or drug related sanctions, we would provide choices, basics, or they also created a CSI, like a cannabis screening inventory program as well. So basically providing just the services as the students need it. And we are trying to figure out like the group support and different things like that, because one of the biggest things that I've noticed is that a lot of students aren't following like the traditional ways of seeking services. So really trying to find like more creative ways. We know that there's the stigma that surrounds mental health and just seeking help in general. So really just trying to find some creative ways to reach our students. But that's a little about me. Thank you.
Thank you. And Embry, will you introduce yourself?
Hey, yeah, my name is Embry. I'm in my second semester of the MSW program at USC, and I am a STIR coach here in the Sape office. And after earning my degree, my primary interest is doing clinical therapy. So, Amy, did you want to go ahead? Are you ready for me to like ask my questions? Did you want me to hold off? Yeah. Okay. So
go for it, Embry. Start us off.
So as someone who's interested in doing clinical therapy, I know we kind of discussed like substance use like prevention and training, but I was kind of curious, like, is there anything that you suggest that I do in order to really just prepare myself to help individuals who are impacted by both substance use and like a mental health concern, like how they interact with each other?
I guess you want me to take that one?
Yeah, I'm curious. Whoever, like, I'm very curious.
Now, say the last part of your question. Let me just make sure I'm summarizing it. You're just kind of wanting to know what steps you might need to take to see like if there is an overlap there.
Yeah, and I think like, right now I'm really learning a lot about mental health and a lot about substance use, but I'm really curious about just how to prepare myself for individuals that are really struggling like with both of those like combined and how they interact with each other.
Yeah. So usually just in that when you're establishing rapport with them and getting to know someone, as you're kind of gaining information about like their history and why they're receiving services, you usually begin to ask questions of how they usually cope with everyday stressors. So as you're kind of learning more about coping strategies and stuff, sometimes people might say like, yeah, I might smoke, I might have a little drink here and there. And we also just specifically ask about patterns of use. We typically have questions in our evaluations that are asking about every substance. And I'm asking details. How old were you when you first tried this? And typically just going through the steps. Also asking about history of substance use patterns and family, and just exploring it all. Typically there's like an initial evaluation, and it kind of gets pretty in depth about just overall use patterns, and just family relationships and everything. For me, I guess because I've been asking questions so long, I usually try to, as you listen, you find a way to kind of get in there, just to kind of see where they are and how they're utilizing any type of substance or what they may be using. Does that help a little?
Yes, thank you so much. I really appreciate it.
Thanks, Embry. And I think it's interesting. Margo brought up screening as a tool for one of this. And I think what you're saying, Dana, is so important because so often we have somebody who comes in and says, I'm having trouble with my anxiety or I'm having trouble sleeping. And if we're not asking about their substance use, we might miss something. And flip side for us, so when a student comes in for a basics appointment, we use the PHQ-9 to screen for a mental health concern because we want to make sure that we're not missing something in a student because we're only talking about their cannabis use. And I think that being able to ask the questions about both is a really important thing, that sometimes we can miss it if we're not making sure that we're exploring both topics or getting students the resources they need for both. Margo, do you have examples of places where folks have done that successfully? Are there other places where screening is being used in creative ways?
I guess maybe not the most creative, but I do know at least one of our campuses has done just a general mental health screening day. So that definitely takes a lot of people power and time, but they will set up shop in places on campus and have some clinicians just say, hey, come take a quick survey. We have some, trained mental health practitioners to talk with you about the results. But like I said, it's pretty involved. It takes some time. But I know that they had a lot of really good outcomes from that and did it a couple of years and considered it a really successful event. But I'm just really excited to hear you all say that those are things that you implement in both of those areas. I think some of the campuses in Missouri have struggled to gain traction with that and have not necessarily been able to implement that in the way you mentioned. So that's great to hear.
Yeah, I think go ahead, Dana.
No, I was just going to add in, since we're a smaller campus, usually for like national depression screening days and things like that, we usually step outside of our counseling center and we'll offer screening around campus. And then as we do the screening, if there's like an indication of a need for services, we'll schedule them an appointment right on site. We might even call like our administrative assistant or something, and we try to follow up. We did when COVID first started. We started using MindWise screening, but this semester we didn't really, well, this fall we didn't even use it because the students weren't really utilizing the online quite as much. It was like when they first got sent home, they were using everything, but when I was looking at the numbers, it was like slowly dropping off. So we weren't really able to, but we do try to do the national screenings. And even in April coming up, we'll do the national the national alcohol awareness, like national alcohol screening. We'll do that. We'll step out the offices and do the same thing. And if there's an indication of a problem, we'll provide them with resources. We connect with the Aiken Center here. They're the ones who do like alcohol and any type of substance use prevention, and they also provide services there. So we'll actually have them come on campus with us, and we may even be able to just collaborate with them and make necessary referrals.
Other questions, thoughts for Margo? I'm really curious. Dina brought up the pandemic and the impact that had. And Margo, I noticed there wasn't a big jump in 2021, like where I would have expected to see kind of a bump in anxiety. You had kind of a steady increase. So what do you think the impact the pandemic is having on both of these, the mental health and cannabis?
Great question. I should have said, I forgot. Really, our 2021 survey was implemented pre-pandemic. All of our surveys were deployed before, I'm sorry, 2020. Oh my goodness, how many years has it been? Our 2020 survey was implemented pre-pandemic, before any campuses were impacted or closed. And so we were really interested to see what our 2021 data would look like. And like you said, really across the board, we didn't see huge jumps. I think we sort of, we thought there would be but I think when we talked as a staff, we thought that potentially any students who had significant enough mental health concerns that maybe they didn't come back to our institutions, or we didn't have students who maybe would have started school, but due to whatever COVID factor, they may have not done that. So that was kind of our thinking. We did ask some questions. We asked reasons for students experiencing certain mental health concerns or stress. We added some new COVID questions, and certainly students identified that those were there. We also did sort of a mid-pandemic in the fall of 2020. We did a separate survey and asked students about some behaviors, like sort of in the height of lockdowns, how they were feeling when they were back on campus. So I will post some links in the chat to some data that we have on our website, but it really was not as stark as we were expecting, I guess.
What have you seen, Laquana, in terms of pandemic mental health?
Yeah, I think what I found by so just traveling across campus and doing pop-up meditation, speaking with students, a lot of what I've heard students speak to is loneliness and isolation. I think with the COVID distress, just having it just really, I mean, I don't think we can speak enough to how COVID has really changed how college students socialize, their whole college experience. I mean, events being canceled or delayed, or classes not even being the same. I've had students while doing wellness presentations say like learning how to be social again when you had to be, online, your classes were online maybe for a year, right? Or who knows? And then having to be back on campus and learning how to be social again. And then dealing with an increase in social anxiety, and maybe there could be, a connection with cannabis use and social anxiety there, with students, struggling with social anxiety, increase in stress and overwhelm, just feeling overloaded with information from social media. I think students also spent a lot of time on social media more than they usually would during the pandemic, and that also just struggling with their place in the world with all that's going on around them. So that's most of the feedback that I've heard from students. Mainly, as of recently, I've heard a lot of just loneliness and isolation.
So sad. Just, we were talking with a student today who said, I'm a senior and my only like normal semester of college was my very first one. And so now it just feels like they feel, I think, robbed of something, for some of them, like they've missed out on some opportunity. But yeah, I think the loneliness. So what are some of the ways, how do we teach students how to manage some of these feelings, whether it is a significant mental health concern that they're coping with cannabis, or just their general feelings of loneliness, isolation, disconnection, that they might be trying to use cannabis to help? What are some of the ways that we can teach them effectively to use other strategies? That's for anybody. I don't have a good answer.
I'll start, if that's okay. I think really mindfulness and teaching them the importance of kind of attention training and focusing on gratitude. Gratitude has been saving grace. Now I can speak for myself, and I think it really, really, there's so much sciences around gratitude and that as a mindful practice of focusing on what's working really well for you. What support systems do you have left post change, right? With all these changes, what do you still have left, right? What is working well for you, and shifting that focus, right? Sometimes our brains are automatic to what in their conscious mind, like what's not working well, like what's happening right in front of us, right? When we really were to sit back and kind of meditate on what's working well for you, right? What is still left after all these changes? I think if students were to have more exposure and opportunities to connect with the art of mindfulness and the different practices that fall under that umbrella of, going on a mindful walk and disconnecting from your phone when you're feeling overloaded from social media, going for a guided meditation, just taking deep breaths and kind of going within, right? Focusing on how am I really feeling, connecting with those thoughts and those feelings, and then making sense of it in safe spaces with others, and then being able to say, okay, like actually, I do have some really great things happening, even though everything that's happening outside of me in this world around us, either on campus or externally in the world that we live in, may feel chaotic. I can always go within, and I can always just take a couple deep breaths, and I can separate what's for me and what's for the world, right? So I think mindfulness can really help if students were to connect with the guided meditations and even yoga, right? Just like that body awareness of getting inside, being with yoga and the benefits of that practice, and also building community, because you're going to also meet other people in the yoga space and the meditation spaces on the mindful walks and in this community that are also working on trying to, cultivate this feelings of hope amidst despair, right? So you get community in these spaces, and you also generate these feelings of hope, amidst feeling despair and isolation and these low moments, because we don't really feed toxic positivity, because we also feel like things are really tough and things have been really tough, but we want to feed that amidst the toughness, there also has been some good. And I want you to shift your focus to that and to cultivate that more and more. So I think mindfulness, I'm kind of biased, but I think mindfulness is a good start.
Yes, I totally agree with everything you said. And even I try to just encourage students to really focus on what is in their control, what they can control. Because a lot of times you get so lost in what you can't control. And it's like, well, here, let's kind of, again, reshift that focus on what you can control. And when you think about what you can control, there's actually quite a few things, and I'll even pull up the emails of like our student news and what we have going on campus, or, just different events, just to see if they may be interested, just to try to connect them with those programs too.
Really interesting. Also, I put in the chat, I want that on a t-shirt. I think I love that. Cultivate hope. We need that on banners around places. So, okay, let me shift it back to cannabis for a second. I'm wondering about, sorry, this is a terrible transition. Margo, you talked a little bit in the beginning of your presentation about the potency and how much stronger the products are that our students are using and have access to. And I'm wondering what's the role of that? And if I remember something in your questions about the different products that students are using, but are we finding that students who are using more high potency products are also having more issues with mental health?
That's a great question. I'm not sure if I didn't break down type of cannabis used by mental health concern, or I didn't cross tab those. I think anecdotally, what we know is that, especially with edibles, there is a higher potential for students to like small o overdose, to take too much, the toxicity if they take one and then aren't feeling the effects and then take another. Certainly we know the potential for that is much higher. And then especially with derivatives and concentrates, things like dabs, they are very powerful. They hit the brain and the bloodstream very quickly. And so I think those two types we talk specifically with students just about. There's, I guess, more room for error, or more room for them to have pretty significant onset negative effects. As far as like sort of what to do about that, or how to talk with students, again, I think just talking about those types and just encouraging them to, recognize how that might impact their body. I know in states with legal adult cannabis, they talk just about like start low and slow, things like that. And then I think too, just talking with them about depending on where they're getting their cannabis, right? If it's from a legal source, if that's something you have in your state, just are they being, are they informed consumers? Are they reading labels about what a dose is? Are they measuring that out? I know in states where it is not legal, that is a completely different conversation and much harder to have, because they don't know, the person they got it from might not know. But I think that in and of itself is just something to encourage them to think about, that they may not have a full picture of what it is that they're consuming. And so again, just being cognizant of that and potentially wary. I know there have also been some national conversations recently about laced products, specifically with fentanyl, or there's sort of a increase in counterfeit prescription medications that are containing fentanyl. And so I know there's a lot of conversations around those things, and just talking with students about knowing, what an overdose looks like of any kind, and encouraging them to potentially get medical attention for someone that doesn't seem like they're okay, regardless of what they have taken or think they've taken, things like that.
Thank you, Margo. And I think I like the little o overdose, because an overdose of cannabis does not look like our students expect it to look. They don't think that that's a thing. Although when you talk within the student culture, I think sometimes you hear some of the terms that they might have for what that experience looks like in someone else. But yeah, I think our students are often really unprepared for what it looks like when somebody's had too much or is having a negative reaction to the cannabis they're using, and how do we don't know how to talk about that or what to do to help someone with that. I also wonder, and Embry kind of alluded to this a little bit with her question, but for Laquana and Dana, like how do we prepare our mental health folks for all of this new stuff that's coming with cannabis? I know when I train the wellness coaches to do the screenings, they keep me on asking more questions about cannabis, because it feels like there's so much information, there's so much misinformation, and they don't feel like they know enough to be able to have conversations with students about this. So how do you kind of feel like you know what you're talking about?
I think especially for cannabis, it is new stuff happening every day. So literally, I just encourage, especially our mental health professionals, just training. I try to just follow different ones. I follow what the Tall Cop says now. Like he has so much information about cannabis, and I even have been talking to some of my staff. Like one of the biggest things that we have to figure out is even how to recognize it, because like now with these edibles and with so many different products, like I mean, when I was working with the Aiken Center, like, I mean, it's like bags that looks like regular cheese puffs, like, and it's edibles. And you're talking like, and you wouldn't even know to question it, you know? So even like for our RMs and at different programming, it's just even knowing that like there's so many different products out there. So really, again, it's just finding trainings, just trying to remain current. I ask a lot of questions too. I'm not a shy person. So whenever I talk to the students, I'm asking like, so what's going on these days? You know, tell me a little bit about this stuff. I'm nosy. Like I want to be all in, like, you know, and that's one of the pieces of my job that I get to do as a counselor. There's not really a lot of limits. You know, I can ask these questions. You know, a lot of times professors may not be able to, but in my role, I can ask, like, tell me about like what's the latest trend. I really just like to know.
Yeah, I agree with Dana when it comes to that. I mean, although I'm not a practitioner here on campus, I do provide therapy outside of campus too, and I see clients, and I think I'm not afraid to ask the questions. I think you can't be afraid to ask certain questions. Once you build rapport, it becomes a lot easier. I would also add to get curious about the client's relation, like their view on their relationship to drugs and alcohol. And I think getting curious about that, like, you know, if a student has a DUI or if they're under the influence and they were engaging in risky behavior, like ask them if they view that as, what do they view that as for themselves? Like, do you find that, you know, that's problematic for you? Like exploring that. I think getting really curious about their relationship and if they view it as a problem, I think would be something I would add to that conversation.
Great. Any final thoughts or comments? Try to put one more resource in the chat here.
The only other thing I'll add, I am also not a practitioner or a clinician at all, but something that I have heard from our clinicians is just like using the terminology or the language that the clients are using. Like, I know there's been sort of a national shift or a shift in like literature to talk more about cannabis, like, you know, but really just using whatever words your students are using, and yeah, encouraging them to just be open and talk about it. And I think there's then also just work to be done among all of us to like remove a lot of the stigma that a lot of us have about perceptions of folks with substance use disorders. And so just kind of doing that internal work and really working to unpack kind of those preconceived notions or thoughts we might have.
And this is such a great way to end and seriously like plug for our next session, because our next coalition meeting, April 7th, Tom Fontana from the University of Vermont is going to be our speaker. His focus is on cannabis, and he is going to talk about a guide that he created called the Tolerance Break or Tea Break Guide. Some of y'all may have seen this. We have hard copies around our office, which we can distribute and share with you, but it is also online. And his focus for that presentation really is going to be, what are the risks we can identify for college students? How do we take a harm reduction approach to cannabis use? How do we help people think about their relationship with their use and make a change, and the value of a tolerance break? And what I think is so great about the work that Tom has done is that he really did start with his student clients and said, okay, tell me more about what's working for you. And so if you've read through the Tea Break Guide, it's their language, it's their words, it's their cultural touchstones that are gonna, that make it feel relevant when you read that as a student who's thinking about making a change. And so I think that's a really great perspective to bring to kind of bookend this conversation about the mental health connection, to talk about what do we do with these students and how do we help them make that shift. So that will be in April. If you would like a recording of this presentation, I'm going to attempt to share the playlist that I made, but our YouTube page for Sape has all of the videos from our coalition research series. There we go. And this one will be up within the next 2 weeks or so if you have other folks who you'd like to share it with. I want to thank Margo again, and Dana and Laquana and Embry for being here and being willing to share your insight and expertise with us. And thank you, and happy spring break. Hopefully everybody gets a lovely mindfulness self-care experience, right, Laquana? Thank you, everyone.
Thank you again.